If I was to think about what life would be like with an electronic health record as opposed to the journey that we've had without it, I think it would take a lot of the vulnerability for my mother out of the equation. I think it would take a lot of pressure off myself and off my father, who is often in a position where he has to try and remember things.
I think it's the single most important enabler of person-centred healthcare. It puts the person at the centre of their health with their health information, and they are the person around which their care should be connected.
Technology is not going to be the problem here. Technology can do this. The question is, do we have the change management? Do we have the policy environment?
E-health has a potential to play a huge role in making the work of junior doctors and sort of students who are going to be those junior doctors a lot easier.
At ACCRM we deliver e-health solutions and education through low bandwidth solutions, and that's going to be a challenge for access to a e-health record throughout all the isolated communities, the Indigenous communities, to start closing the gap.
The shared electronic health record, or the patient-controlled electronic health record, is getting information to the right person at the right time, so that that person can make a well-synthesised, better decision.
It's hard to share information when people have different programming and different software packages, and there's a mixture of sort of handwritten documentation in the community and different programs in public hospitals, so that can be frustrating for junior doctors and patients as well.
Beneficial for the patient because we often get a lot of calls from emergency department requesting urgent information. After hours, when our doors are closed in the general practice, the ED can't get that information. So to have a repository where they can actually get that information and speedily treat our patients, and vice versa, that we can get back information from them, then that has to benefit the patient. And it also benefits me because I'm not having to chase it all the time.
Any nurse will tell you anything that takes them away from spending time on paperwork that frees them up to spend time with their patients and clients is what we're all looking for.
You know, I'd have a lovely dream where we'd have a beautiful, seamless, integrated national system that, you know, worked well for women and for all of their care providers, and where perhaps every midwife had a laptop.
An effective e-health system would really help facilitate good case conferencing and multidisciplinary cancer care.
The winds of change are blowing, and this is a brilliant process.
I think even more important than involved with seniors, I've got children, I've got grandchildren, so that I can see this is going to be very valuable right through the generations.
Yesterday I was 64 and I'm on a 36-year plan, and I'm certainly not going to remember everything that happens to me, so I'd like somebody else to take care of it and to know that it's available, correct, that I have access to it, so that if there are any things that I need to correct or add, then that can be done. I also want to know that it's private and confidential but available to those who need the information.